Hi everyone, welcome to the first edition. I'm not Kristen Tribe today, but I am Amy Hermes. I'm the telehealth director for Wise Health System, and I'm here with a very special guest today, Dr. Tibbles. He works for Wise Health Clinics. He's been around in the community for many, many years, providing primary care to all of our citizens. And today we wanted to talk to him about telehealth. So Dr. Tibbles, I understand with COVID being around, that's changed a lot about how people can go in to see the doctor, and precautions are being taken to try to reduce the spread of COVID. And part of that is providing care whenever patients don't have to actually come in. That way there is no risk of spread. So have you started to offer this in your clinics?
Yes, we have. In fact, COVID has pushed forward telehealth by probably 5 years, I would guess. And there's been a delay with the, I guess the insurers have been reluctant to come on board with telemedicine, but with the pandemic, it's put us way ahead in terms of what we're doing with telehealth. It's one of the things that's really helped us to be able to continue to take care of our patients,
Right.
have some contact with them, and in fact, a very good contact in for most respects, if we're able to actually see them on the TV and actually visualize the patients. And so it's been we've known that it's going to be a really strong and good tool to use. We just not been able to implement it. And all of a sudden it's thrown in our laps, and it's just a very nice tool to have in the toolbox.
Exactly. So with the pandemic, as the regulating boards and the payers started to realize that patients still needed care, but we didn't want to put them at risk of being out among people who may have COVID, they started having waivers that would allow patients to be seen from home using video, sometimes using telephone, and that those services can be billed through your insurance instead of a cash pay service. Have you found that your patients are very receptive to it, or do they still want to come in over and take the risk of exposure?
Well, the patients love it.
Okay.
First of all, they don't want to get out. They don't want to put themselves at risk. And, it's a mutual risk thing. There's a risk from us being exposed to them as well as from them being exposed to us. And so having a barrier, if you will, to be able to communicate provides an element of safety. And for a number of patients, that works just fine. They don't have to necessarily have a physical hands-on examination. If they do need a physical hands-on examination, then we have to make a different provision for that.
Right.
Take some safety precautions here in the office to be sure that we keep exposures to a minimum, but it's been extremely well accepted by the patients. They absolutely love it.
So if I understand right, you're doing some video visits, and you're also able to do telephone visits for some of those who don't have capability to do a video visit. What types of patients are you seeing? What are some of the visit reasons that people could use telemedicine versus actually coming into the clinic for?
Well, I've had visits from patients who were sick. We've had some patients that we've actually tested for COVID. None have been positive, thank God, so far. But there were some sick patients that we visited with, and we were able to keep them at home and keep them from exposing the staff, as well as personally being exposed. And we're able to get them tested and then provide treatment over the TV, if you will, the visual screen, and do that also over the telephone. And it also puts me in a position where I can do that even from my home. I mean, I can call the patients up and talk to them, and at different times of the day. And I've had patients that call on the fly and need to be seen and talked to. We're able just to hook up, and if they've got the capability for video, we're able to visit just like you'd visit on Skype or FaceTime or even Zoom now. People are using Zoom, but it's nice to have a look-see at the patient to check them. And there are a number of physical exam things that you can do over the television. It's not perfect by any means, but it's a way of maintaining contact during this time of infectious disease.
Correct.
We want to limit exposures.
And our clinics are using a service that is HIPAA compliant, so people can be sure that their privacy is ensured and their records are not stored on video. Nothing's kept in that format. So I think it's a pretty safe feeling to patients to know that they can reach out to you and still be seen privately and have their care taken care of. Any last words of wisdom or any educational points you want to talk to the patients in the community about?
Well, no, other than I would not be afraid at all to participate in telehealth. It's a way for us to maintain contact. We have what are called checkup visits, where Medicare allows us just to call and check up on our patients to see if they need anything, refills, things like that, and to just check on their welfare, as well as a full-fledged visit with the telehealth platform. And both of those are available for us to use. It's nice to have that. Of course, it doesn't substitute for an office visit completely, but in this day, it certainly provides us a way to maintain contact and limit exposures, both for the patients and for us.
Exactly. And so I think the last words I would remember is telemedicine's been around for quite some time. The difference now is that it's available from your own provider, from the comfort of your own home. So all of our Wise Health Clinics locations do offer telemedicine services. You can just give them a call if you need to be seen, and they can help set you up for that visit. So to summarize, I would say telemedicine is here in Wise Health Clinics in all of the locations. You have the advantage of seeing your provider from the comfort of your own home. So what you need to do that is just call your clinic, request a telemedicine visit. They'll step you through how to access your provider and how to join the video visit so that you can take care of your medical needs from home. And you can also access the information on our website, wisehealthclinics.com. Thank you.